Welcome to Vaso-Meditech HealYourHeart EECP Treatment Center. Today in this video, we are going to discuss about extreme weather pattern. So the weather could be extremely cold or it could be extremely hot. So today our discussion is going to be exposure of cardiac patient to this extreme hot weather. So when the temperature is very hot and humid, it poses a lot of risk for patient with heart disease or people who seems to be normal or they believe they are normal but they have an underlying heart disease, or even people with no heart disease. They all have some sort of risk when they are exposed to the hot weather for a prolonged period of time. So basically our body has an ability to defend cardiac problem during exposure to hot weather, and these two mechanisms are called radiation and evaporation. So radiation means when the temperature outside is cooler, so when the body is hotter, it means it can able to radiate the heat from your body to the cooler environment. This is called radiation. Sometimes when your body temperature rises or when the temperature outside is very high in 3 digit, for example, a normal patient temperature is around 96 to 99 Fahrenheit. Let's assume the external environment is more than 100 or 104 or 105. Then what will happen? Your radiation fails because it's not able to radiate your heat outside, because the outside temperature is also very high when compared to the body temperature. So what the body does is it shifts to a second mechanism called evaporation. So it forms sweat. So what happens is when the sweat forms, it starts accumulating in the skin surface, so making the skin little bit cooler. So when this happens, still it can able to evaporate when the temperature outside is dry. But this may not be possible when the temperature is very high and humid, because the atmosphere itself has a lot of water, so that evaporation cannot happen. When this happens, what happens is your body try to make yourself little bit cooler by pushing more and more blood to the periphery circulation. So more blood has to enter to a skin so that the vessel can dilate and try to dissipate or try to radiate or evaporate the sweat which is on the outside. When doing so, what happens is your heart has to pump harder and harder. So in fact, it pumps so hard as if it is 2 to 4 times harder than it is normally does. And also what happens is it can also pump faster. So your heart rate goes up and your pumping efficiency goes up. This usually happens when you are doing an extreme exercise. So just understand, just you are standing in a hot summer and your heart is pumping so faster and harder, then what happens is people with already existing heart disease, they may suffer a heart attack or irregular heartbeats, and people who believe they are normal but they have an underlying heart disease also can suffer a heart attack. So it is better to make sure you take some corrective step when you are going to expose to a hot environment. Some of the corrective steps are wear a hat so that you are in a shade, and then you can put sunscreen, and then keep on sipping water. Every 20 minutes keep sipping water whether you are thirsty or you are not. But people with heart failure has to be careful, because we know they have to restrict their water intake. So they have to speak to the cardiologist before they get exposed to a very hot weather. And also try to avoid alcohol, and also try to avoid any juices, because alcohol and juice can prevent water absorption or slower your water absorption. So plain water is a best bet if you want to go and expose yourself to a hot environment. And also if you are a heart disease patient, make sure you don't expose for a longer period of time, and also wear a loose clothes so that the sweat can able to evaporate.